Dr. Eli Reshef, another video, this time on what we call add-ons. Add-ons are optional additional treatments in IVF, or either procedures, medications, or similar, who are offered alongside the standard IVF protocols. And of course, the goal is to improve the chances of success. This video is based on good practice recommendations on add-ons by the European Society for Human Reproduction and Embryology, by their working group, and that was published in Human Reproduction, their journal, in September 2023. I'm going to divide it by recommended, can be considered, currently not recommended for routine use, and not recommended. So let's start with recommended add-ons. Calcium ionophore for complete fertilization failure, embryo glue, those are recommended treatment. But the word about calcium ionophore, it's been disappointing regarding improvement in egg maturation and fertilization rate and embryo development. So it has to be considered selectively. In the category of can be considered, hysteroscopy for recurrent pregnancy loss, RPL, and the microfluidics, what we know as Zymot, in case of issues with sperm, are issues that can be considered. Currently not recommended for routine use, and the list grows, is hysteroscopy routinely before IVF, ICSI, ICSI, intracytoplasmic sperm injection, PGT for routine use, pre-implantation genetic testing for routine use, Duostim, calcium ionophore generally as a kind of a blanket treatment for egg and sperm issues. In vitro maturation is not recommended for routine use. Sperm DNA fragmentation testing, not recommended for routine use. What we call PICSI, PICSI, and sperm hyaluronic acid binding, not recommended for routine use. Vaginal culture, not recommended for routine use. Endometrial scratch and elective freeze-all in all cases. What is not recommended, and that's important, to do ICSI, ICSI for non-male factor, endometrial receptivity tests, antioxidant therapy, natural killer cell tests, intralipids, IVIG treatments for recurrent pregnancy losses, assisted hatching, time-lapse imaging, intrauterine or intraovarian PRP, that's platelet-rich protein plasma, metformin, testosterone, growth hormone, DHEA, baby aspirin, intrauterine administration of HCG, the routine use of steroids for IVF, whether it's for transfer or retrieval, and interestingly, acupuncture for the sake of improving pregnancy rates. And again, some of those treatments are good for, let's say, stress reduction, like acupuncture. But I think we need to get some sanity into the add-ons, which patients are clinging on to in desperation. There needs to be a little bit of awareness, great awareness, not a little bit, among you patients about what's recommended, what's not recommended. So feel free to read the article. It's in the September issue of Human Reproduction. It's a very sane review of some of the add-ons that we've been using over the years. Thank you.